to me anyway, the biggest issue of the session thus far has been Medicaid expansion, whether to expand or not. The governor, Mr. Scott, is for Medicaid expansion under Obamacare, at least out 3 years. And committees in both the House and Senate have said, nope, don't think so, we're not going that way. And you, Mr. Speaker, have been most outspoken in saying that's not the right way for Florida. Could you give us a brief summary about what most concerns you about moving toward expansion of Medicaid, which would include probably 900,000 Floridians if expanded under the Obama paradigm?
Well, there's a couple of problems with it. I think the first problem that we have is it's relying on the federal government to pay for something that they have no ability to pay for. It seems like every other month they're having a debate about the debt ceiling, but yet they want us to believe that they're going to pay for hundreds of billions of dollars of Medicaid expansion in every state across this country, and it's not sustainable. And on top of that, what I think the other big challenge that we have is you want to be careful about growing a government program, because there's nothing wrong with providing health care to Floridians. We want to find more people to have insurance. That is something that is a laudable goal for our state. But to put people on a program like Medicaid that already has challenges, that already has access issues, if you have Medicaid, the odds are you have a challenge getting specialists to see you. So before we put another 1 million people on that system, we ought to think through what the other options are for our state. And I have concerns about creating a dependent society on government. And so what I think the Senate President and I have worked on, and where we are right now, here we are in just a few weeks into session, the conversation is not about growing government. The conversation is about health care for our state, and how do we do it in a way that embraces the private sector solutions as opposed to government.
Mr. President, what you hear from people who would like to see Medicaid expanded is, the federal government's going to provide full reimbursement to the state for at least 3 years for the expansion. What's going to happen if you don't take that money? I believe the committee in the Senate dealing with this under Senator Negron has basically said we can come up with a state paradigm that's different from Obamacare and still draw down some funds. What is he talking about, or what direction is the Senate going in? Toward a private insurance program that maybe is based on managed care? Bring us up to date.
Well, first, I think the Speaker did the right thing by laying out the reasons why we can't always trust the federal government to do everything that it says it will do. Not because everybody in Washington's a liar, although there are a few liars up there, but because sometimes fashions change and priorities change. I was a superintendent of schools. I remember when the federal government said they would always pay 40% of the costs of IDEA. That's the federal program to provide extra educational and healthcare services to disabled students. You can count on it. 40%, you're covered, it's a guarantee. On their best year, they haven't paid any more than 23%. And the costs have been shifted onto local school districts and taxpayers in states. So it's not that bad ideas necessarily turn into bad results, although that happens. It's that sometimes fashions change in Washington. So the Speaker has taken a cautious view that we can't rely upon people who can't even seem to balance a budget or even have a budget or even pay for the defense of our country. So I think that's a pretty cautious view. Now, where the Senate is we've said no to Medicaid as we know it. We want to go, I think, further than maybe some people would like to go, and that is we'd like to end the Medicaid system in Florida as it has become, as the Speaker said so correctly, a system that makes people dependent on a health care process that doesn't provide them either access or sometimes quality. And it's certainly something that providers and taxpayers and patients don't seem to like. So we want to have a system that would rely on private insurance. Perhaps we can provide some assistance to people who can't afford private insurance to be able to buy it. 70% of the people in this state between 100% of poverty and 138% of poverty are the working poor. They have jobs, they're trying to support their families, but they can't provide health insurance. So we think there's a private sector solution. Senator Bean as well as Senator Negron are both working on ideas that would have us buying into the private market, not expanding Medicaid as we know it, actually ending Medicaid as we know it for everybody and using a private sector solution. That gives more people more choices, family plans, individual plans. Folks can have skin in the game. They can have incentives to have healthy lifestyles. They can have co-pays so that they have some personal responsibility. That's very different than what President Obama has asked for and what Governor Scott has endorsed, and that is simply expanding a failed Medicaid system. I'm encouraged that the governor has now started to say, and I can't speak for him, but he started to say that he sure wants to listen to the House of Representatives and the Senate, and hopefully we can come to a solution.
Only about a minute left, Mr. Speaker. What I've just heard from the President is that you're not saying we're not going to cover that cohort of 900,000 people. You're saying you're looking for a new way, a different way than the Federal Health Care Act to do it.
I'd say we're looking for a private sector solution. And whether we covered all 900,000 people or not is up for debate. I will tell you, if you're a child in the state of Florida, you're covered up to 200% of the poverty rate. If you're a family, have a mother or father with a small family, most likely you're covered under Medicaid if you meet that threshold. If you're pregnant and you're a female, up to 185% of the poverty threshold. The challenge is, if you're an able-bodied single adult, at what point is it the government's responsibility to provide for your health care? And I think there's a debate that needs to take place about that in this country. We cannot afford, as a government, to pay for health care for everybody. There are able-bodied people in this country that are going to have to take themselves up by their bootstraps, work hard, and provide for health care for themselves. We should believe in a safety net. We should find that safety net, and we should make sure it's strong. But we have to define what it is. And I think this debate will be about finding a private sector solution to define the safety net and provide as much coverage as we can to the Floridians who need it.